Have you ever injured a muscle and wondered what you could do for yourself? One of the options that can happen either in the clinic or you can do on your own, depending on where the tissue is instrument-aided soft tissue massage or mobilization, also known as scraping. There's a couple other key ones out there that have names like Graston, which is kind of like the Kleenex is scraping. There's a couple other ones that are out there that kind of work, but they all kind of work off of the same theory. When you have a muscle injury, you have neuromuscular junctions that kind of come down, and you have a normal colonization of how the muscles should be with different structures. What can end up happening after an injury, these structures can be kind of like go from nice straight lines to being more squiggly lines, almost where it can start to look like a little bit of cotton candy. I'm using green, but this structure can happen like this. One of the analogies that I use often is like a bungee cord, especially if it's more tendon, where the muscle and the tendon meet together, and you kind of do this shear force through it. You can end up with a little area of like an infarct within the area in the cross section, and that's going to lead to an area that has decreased circulation, and everything else kind of gets around it sensitive. And that's what we can see with some of these things, like on golfer's elbow, where you squeeze something. When you go to squeeze it, the more tension you get where these neuromuscular junctions are, it takes this cotton candy or scribble and causes it to contract, which causes the pain. What we can do is we can use some scraping that can help remobilize that to kind of get that tissue so we can get the structure to look back to normal. One of the key factors that I find with things is that, especially with scraping, lighter is better and softer is better, and smooth, like it's like one of those things of like smooth is fast and fast is smooth kind of things. When we start to work through different tissue, it's not about beating up the tissue and going as hard as you can. You'll see online where a lot of people start to scrape and they just dig as hard as you can. When you do this with a tool, this is a T-tool, there's a lot of varieties. You can go to Amazon and buy a bunch of different ones, but you can work through, and this is like what I'll use for my own self-care. Like using my hands all day, I'll get through this. And it's just a soft movement through. And as you can kind of see, it's starting to get a red. As I'm going through this, I'm not using a whole lot of force down. And then you can start to go through a little bit of movement as you go through this. And you'll start to see a little bit of redness, some petechiae. You can break up some blood vessels. That's not the goal. We want to get deeper circulation to this. This is a small area, it's a more sensitive area. We don't want to be going hard over tissue. We don't want to annihilate, we want to activate. So we want to get more vascularization to the area. If you're starting to see black and blue, you've gone too hard. If you want to see just a little bit of red, and then start working it through, and you can take this through. It's a gentler thing, and a lighter touch goes a longer way. It's not deeper is always better, especially when it comes to superficial muscles.